Tonight, reports say medical staff are told to keep their mouths shut about illegals flooding our country with contagious diseases or face arrest. This, as the situation at our border and at facilities all over the country continues to deteriorate. With me now, the former director of the Association of American Physicians and Surgeons, Dr. Elizabeth Vliet, who practices in Arizona and Texas. All right, good evening, doctor. What do you know of these kids walking around with dangerous communicable diseases?
Good evening, Judge. It's a pleasure to be with you. Thank you for addressing such a critical issue. We know from the reports from the Border Patrol that there's a high incidence of tuberculosis, of swine flu, chickenpox, measles, scabies, lice, many contagious diseases that are coming as invisible carriers with the people coming across the border now.
All right, but the role of the CDC, aren't they supposed to be telling us this so that we can prepare for this?
Yes, in my medical career, I have not seen the CDC be so strangely silent. Texas Department of Health and Public Health has actually sent out multiple alerts. I had 3 alerts just in one afternoon this past week. Arizona Public Health has been strangely silent as well, and yet my information comes from the Border Patrol. I received a copy of the union letter warning the Border Patrol agents of what they needed to do to reduce their risk, which I commend them for doing, but yet we're not hearing from the officials that are charged with the health and safety of the American public.
Are we facing a full-on public health crisis now, doctor?
Well, in my opinion, yes. I've spent the last 5 years doing medical projects in Central America and South America. In fact, I was only recently back from South America. And one of the things that's quite staggering is the fact that 75% of these illegal border crossers now are coming from countries other than Mexico, countries that have a high incidence of drug-resistant tuberculosis that is well known in Central America and South America. So we are seeing a new disease pattern. We're getting into the incubation period, beginning to run out. School is starting in a few weeks in Texas and Arizona, certainly. So you have crowded conditions, hot, humid conditions, unsanitary conditions, and you have people that are carriers of bacteria and virus and the other contagious diseases that have been reported. We already have Border Patrol agents that have tested positive for tuberculosis, and this is not a simple matter.
What is your reaction to reports, doctor, that the medical staff are being threatened not to speak out about the concerns?
I'm absolutely shocked. I've never encountered anything like that in my entire career. And not only that, people have said, well, it's a HIPAA violation. It's not a HIPAA violation. Doctors and nurses have a responsibility to help educate the public about health risk. We don't violate HIPAA as long as we don't reveal an individual patient's name.
All right. All right, doctor, I'm sorry we don't have more time. Thank you so much. With school starting, this is going to be a nightmare. Thank you.
Thank you.
All right, and coming up, jihadists at the border, why the president needs to address this national security threat before it's too late. And it's your last chance to vote in tonight's Instapoll. What should we do with the thousands of children crossing into our country? Facebook or tweet me at Judge Janine.